Hi, I'm Dr. Arash Hakhamian, the modern dentist, and I'm an emergency dentist here in Los Angeles. Emergency dental care is not really thought of until you have severe pain, randomly in the middle of the night, or just showing up when you least expect it. So dental emergencies are often caused um, by basically missing routine checks. Most dental emergencies, I would say, have to do with either cavities or gum disease that has been left untreated due to lack of recalls, lack of x-rays, and a lack of maintenance care. Dental emergencies can occur at any time and without prior notice. In fact, dental emergencies are just like other problems in the body. High blood pressure, high cholesterol, diabetes, even HIV and some cancers have no symptoms. You won't feel any pain before they occur. In fact, one of the leading causes of death, which is heart attacks, is oftentimes known as the silent killer. They call heart attacks a silent killer because you don't get any kind of notice beforehand, and all of a sudden, boom, you have a heart attack, and God forbid, something really bad can happen. Strokes are the same way. Ironically, dental infections and dental decay and even gum disease can contribute to heart attacks, strokes, Alzheimer's, dementia, prostate issues, even premature birth. So what do we do if there's a dental emergency? Now, emergency dentists are extremely hard to find. So most people end up in the emergency room waiting for several hours, and ultimately dental emergencies are not really treated well at emergency rooms and urgent care centers. So unless you have severe swelling and just excruciating pain and you're unable to find a dentist, I would say going to going to an emergency room is probably not going to help tremendously. Most of the time, they'll give you some antibiotics and pain medication and have you look for a dentist, because unfortunately hospitals and dental urgent care centers are, hard to find, and not a lot of dental offices are open 24 hours a day. So dental emergencies usually get really bad at nighttime, especially if you need a root canal, and you're basically waiting until you lie down. You won't really feel much of the symptoms throughout the day, and it can get worse at nighttime when most offices are closed. So one of the first things to do is make sure you're getting routine dental examinations. That way doctors and dentists and your hygienists or whatever your dental practitioners can take x-rays early on and let you know ahead of time that you have a problem and that this is something that should be addressed before it turns into an emergency. Now, root canals are caused mainly by cavities that are left untreated, and you won't feel the pain until the cavity actually reaches the nerve. So the way you can find out to see if you have any dental cavities is by taking x-rays and getting a clinical exam by a dentist. Now, trauma can happen, and accidents do happen. People fall down, things, sports injuries, fights, and other traumatic experiences can also cause teeth to be basically knocked out. If you have an emergency where you have trauma to your teeth and you have a tooth that becomes loose or falls out, my recommendation, if it falls out, is just to clean it off with a little bit of water. Try not to touch the root as much, and basically keep it in your mouth. Do not put it in water. Do not put it in hydrogen peroxide. Don't put it in bleach. Just keep it in your mouth. And in fact, if it's clean, if you can keep it in the socket, that's the best thing to do. If it's just loose and comes to be a little bit mobile, just leave it there, don't bite on it, and try to get to a dentist as soon as possible. There is a solution called Hank solution, where if the tooth gets knocked out, you can put it in this specific type of solution that hopefully you would have access to and have purchased before, just in case. Now, mouth guards are extremely helpful in sports to prevent any injury to the teeth, but oftentimes, someone takes a fall, is riding a skateboard, or unfortunately something hits the tooth, and this is something that is out of everyone's control. But the sooner you get to a dentist, within 30 minutes is the time to get to a dental professional that can address it. Oftentimes, if a tooth is loose, we can splint the tooth to the adjacent teeth, which basically means stabilize it by using the adjacent teeth that are still sturdy. And if a tooth becomes loose, oftentimes we can still save it with a root canal and by basically immobilizing it so it's not constantly moving. Now, if you are in extreme pain, something that a lot of people tend to do is they take an aspirin and they put it next to the tooth that's hurting. That is the worst thing that you can do because you'll get an aspirin burn. So aspirin is not meant to be kept in the gums or on soft tissue. So do not put an aspirin around where the tooth is hurting. Also with dental emergencies and dental pain, sometimes the pain can actually radiate to other areas. So if you have a infection, for example, of a lower back tooth, a lower molar, that pain can radiate all the way up to the ear and you'll actually feel it in the whole region. So just because you have pain in your ear or in your jaw doesn't necessarily mean that it's an ear infection. It could be related to a tooth that's broken or cracked or is infected on the lower molar area. One of the other things I'd like to guys talk about is infections. So when you have swelling, oftentimes known as an abscess, this is something that's more serious and needs to be addressed immediately with antibiotics. If the swelling is left untreated, that swelling can actually move and that infection can move into spaces in your throat which will block your ability to breathe. And then it becomes a life-threatening emergency, and oftentimes that requires an incision to be made on the outside of the face, allowing the pus to come out and drain out. So if you feel like you're getting swelling, and oftentimes it'll show up as a pimple. Now the pimple can come and you can see some of the pus come out and then it'll go away. At that point you have what's called a fistula. This is an abscess, and that pus is just looking for a place to drain.